Hi everyone, my name is Allison Lucchese. I'm a licensed marriage and family therapist and the program director of OCD services for Embracing You Therapy. I wanted to talk about the role guilt and shame play in OCD and how to overcome it. Guilt and shame are powerful emotions that can often fuel OCD symptoms. Guilt rises when a person believes they've done something wrong, even when they know their fears are irrational or baseless. So, for example, if someone is struggling with harm OCD, they may feel an overwhelming guilt over an intrusive thought about harming a loved one, despite not having a single intention to act on it. So this can also be seen in examples of taboo thoughts and pure O. So this guilt then drives compulsive behaviors such as seeking reassurance or avoiding certain situations in an effort to neutralize the perceived threat of their actions. So the question then, of course, becomes, how does someone overcome this? So the first step would be to recognize that the thoughts are not actions. So again, a thought is just a thought. Having an intrusive thought is not the same as acting on it. Remember, intrusive thoughts are a hallmark of OCD. However, they do not reflect a person's true intentions or desires. The second step would be to practice self-compassion. So developing this step is crucial in reducing feelings of shame. So people who struggle with OCD often hold themselves to impossibly high standards, believing they must always be in control of their thoughts and behaviors. Another important note to remember is that practicing self-compassion involves acknowledging that everyone has unwanted thoughts from time to time, and that they're struggling with OCD does not make someone flawed or unworthy. Self-compassion exercises such as mindfulness and self-kindness can help individuals replace shame with understanding and patience. The third step would be to engage in exposure and response prevention therapy, otherwise known as ERP, and as everyone knows it, the gold standard of treatment for OCD. So ERP directly addresses the guilt and shame associated with the condition. By gradually exposing yourself to the obsessions without performing compulsive actions, you can learn that your fears are unfounded. This process helps to reduce the emotional weight of guilt and shame over time, as you begin to see that your thoughts do not lead to harm or any wrongdoing. So to wrap things up, OCD goes beyond what most people would see in movies or on a television show. OCD can impact your relationships and other intimate parts of your life. Finding a therapist that specializes in OCD is so important. And as always, if you have any additional questions, you can contact our office for a free consultation, or you can visit our website, embracingyouTherapy.com, for additional information.